Hello everyone, my name is Kirti Sinha, student of second year B Physiotherapy, is here to explain you about the topic that is enuresis. So enuresis is also known as bedwetting. Enuresis means passing of urine without intending to while asleep. This happens after the age at which staying dry at night can be reasonably accepted. It might occur twice a week for 3 consecutive months, and it is more prevalent in boys than in girls. Enuresis is categorized by involuntary urination during sleep. It is multifractional disorder with various contribution factors including genetic predisposition, delayed maturation of bladder, and hormonal imbalance. So let's see the classification of enuresis. So classification of enuresis is primary, secondary, nocturnal, and diurnal. So in primary, the child would never be dry at night, and in secondary, the child begins to wet the bed night after the span of normal continence, and in nocturnal, voiding urine at night only, and in diurnal, the child passes urine during the day and while awake. Now let's see the causes of enuresis. So stress, anxiety, urinary tract infection, juvenile diabetes, and hormonal imbalance. Let's see the investigation of enuresis. So first is checking the medical history. Second, congenital and neurological examination. Third is the test like DM, DI, CRF. Fourth is examination of urine. Fifth is evidence of urinary tract infection, and sixth is the ultrasonography. Now, this enuresis can be managed by non-pharmacological treatment, motivation response, pharmacological management, and physiotherapy management. So let's first see the non-pharmacological treatment. So in non-pharmacological treatment, we have behavioral therapy. In that, first we never have to humiliate the child for bedwetting. Always encourage the child for being dry the whole night, and sleep by 10 p.m. after voiding. Limit the fluid in the evening of the children. Second is the alarm therapy. So elicit a conditional response of awakening to the sensation of full bladder. Ordinary alarm clock can be put to awake the children to prior usually their bedwetting. Now let's see the pharmacological management to cure the enuresis. So first is barbiturates, antihistamines, diuretics, and antidiuretics, that are the drugs that can be given to cure the enuresis. So there are also some of the physiotherapy management that can help the enuresis to cure. So it helps the parents to understand the problems and helps in managing the children problem. Supportive management and encouragement for the patient. Encourage communication with child. Advise decrease fluid intake after the sleep. Parents should be taught to observe for side effect of any medication. Remind the child to empty the bladder after every 2 hours. Thank you. This was all about the topic enuresis.